Good evening, everyone, and thank you for joining us for today's call. My name is Emil Dufresne, and I'll be your moderator for this discussion on veteran benefits and what the Department of Veterans Affairs is doing to ensure Texas veterans continue to receive the benefits they have earned. In a few short minutes, we'll start taking your live questions. If you'd like to ask a question, just press *3 at any time. I'm pleased to introduce a very special guest we have on the line, Mr. Rob Worley. Mr. Worley is the Executive Director of the Houston Regional Office at the Veterans Benefits Administration. He oversees almost all benefits for veterans in the Houston area. That includes everything from disability compensation to non-service connected pension to education and home loan benefits, just to name a few. Pretty much any benefit outside of health care. Mr. Worley is a veteran himself, having served in and retired from the U.S. Air Force. He knows firsthand what it's like to enter into the VA system, and that's why he's working hard to make it better every single day. Mr. Worley, thank you first for your service, and thanks so much for doing this call today and being willing to speak openly with Texas veterans during this very difficult time.
Emil, thanks so much for that kind introduction, and a big thanks to everyone who's joining us on the phone right now. I'm really looking forward to taking your questions and providing an update on all the steps we're taking to make sure we continue to deliver veterans benefits in the safest, most timely fashion during this extraordinary time. Like Emil said, if you'd like to ask a question, please press *3 at any time during the call. We'll take as many questions as we can get to this evening. At the Veterans Benefits Administration, we are the starting point for all veterans seeking help from the VA with any benefits and services outside of healthcare. As Emil mentioned, that includes everything from disability compensation to pension and fiduciary benefits, home loan guarantee, education benefits, veteran readiness and employment, life insurance, and transition and economic development. Before we get to your questions, I want to start out by giving you a brief update on how we're continuing to work to get veterans the benefits they've earned as safely and as seamlessly as possible during the pandemic. I also want to highlight a few hot topics and changes that might be of interest to you. So once again, if you want to go ahead and submit your question, press *3 at any time. We have some great folks waiting to talk with you and take care of you. So let's get right to the heart of why we're calling you. Many of our veterans and much of the nation are wondering how the pandemic might be affecting them in relation to the VA. Our goal in connecting with you this evening is to reassure you that even in the midst of this historic crisis, we continue working on behalf of our veterans. Allow me to share what that looks like. VA has implemented an aggressive public health response to protect and care for veterans as we continue navigating the COVID-19 pandemic. We're working directly with the Centers for Disease Control and Prevention and other federal partners to monitor the outbreak of the virus and provide you, your loved ones, and the public updates as we receive them. To date, the VA has administered at least one vaccination to 4.6 million people nationwide. 4 million veterans have been vaccinated, while thousands of other vaccinations have been provided to VA employees, federal partners, and caregivers of veterans. Approximately 330,000 Texas veterans are vaccinated. This is approximately 64% of the enrolled veteran population in Texas. VA facilities are offering COVID-19 boosters following the recommendations by the CDC so that we can slow the spread of new variants. If you received an initial series of the Moderna or the Pfizer vaccines, you can get a booster shot at least 6 months after your second shot. If you initially received the Johnson & Johnson vaccine, you can get a booster shot 2 months after your initial dose. Eligible individuals should check with their vaccine site ahead of time if you have preferences of vaccine. However, based on recent recommendations by the CDC, the mRNA vaccines such as the Moderna or Pfizer BioNTech should be offered as a first choice. At this time, 1.4 million veterans have received the booster dose of the vaccine. We're also following the CDC guidelines in other areas of VA outside of healthcare facilities. At the beginning of the pandemic, we temporarily closed all 56 regional offices to the public, while at the same time expanding our virtual services tremendously. Virtual services have allowed us to continue supporting veterans and their families while limiting exposure to the most vulnerable populations, like older veterans or those with underlying health conditions. Most services that have typically been provided in person are available via telephone at 1-800-827-1000 or online through www.va.gov or VA Video Connect. Currently, our regional offices are open and providing varying levels of public-facing services in areas such as VSO access to buildings, hearings, public contact operations, and veteran readiness and employment services. And we have a limited number of employees in the actual facilities. The decision to open the regional offices with these modifications depends on the local infection rate and COVID posture of the city, county, or state of that regional office. COVID-19 guidelines are being followed to include such things as entry screening, wearing masks, sanitizing surfaces, and the use of plexiglass shields. So what does that mean for you? Well, what it does not mean is that we are shut down or that your claims or benefits are on hold. It does not mean that. If you currently receive benefits, you should not experience any interruption in service. What it does mean is that your VA has been working for you throughout the pandemic. In addition, we're getting a lot of questions on compensation and pension, C&P exams from the VSOs, states, counties, and through social media. So here's our latest update. Due to the ongoing pandemic, the VBA Medical Disability Examinations Program Office is working closely with our contract vendors to track all canceled or pending examinations, to include any and all overseas examinations. There have also been some questions about GI Bill benefits. When university closures posed a potential problem for education and housing benefits, the VA worked with Congress to put a bill on the president's desk. And we did that in just 4 days to preserve these crucial benefits and to continue GI Bill payments for training and housing. Thousands of students nationwide had to convert to distance learning to replace physical classroom settings, and many continue in that mode today. You'll be interested to know that just last month, President Biden signed into law the Remote Act. That's Responsible Education, Mitigating Options, and Technical Extensions Act, which will further extend GI Bill COVID provisions. So what does that mean for you specifically? Well, GI Bill students will still be able to receive the in-person monthly housing allowance rate while attending courses solely online due to COVID. These provisions will be extended from December of 2021 all the way through June 1st of 2022. For additional questions, you can call the Education Call Center at 1-888-442-4551. That's 888-442-4551, which on your keypad spells 888 GI Bill 1. And you can call that call center Monday through Friday between 7 a.m. and 6 p.m. Central Time. Further, you can get even more information about benefits overall or file a claim by visiting our website at www.va.gov. Veterans with any questions regarding claims or other matters may also request information by calling our 800 number 827-1000.
Thanks for the pandemic update, Mr. Worley. I'll repeat that number. You can call 1-800-827-1000 at any time to learn more about filing a claim or any other VA matters. And don't forget that at any time during this call, you can press *3 if you would like to ask a question. Mr. Worley, before we go to the phones, can you share any other new updates Texas veterans should be made aware of?
Absolutely, Emil. Thank you. I want to highlight 6 new presumptives that were recently added last year. And when we talk about presumptives, we're talking about the fact that VA presumes service connection for certain medical conditions that relate to someone's medical or someone's military service. And for the very first time, VA is presumptively granting toxic exposures claims to Gulf War veterans, specifically those who are exposed to fine particulate matter and suffer from asthma, sinusitis, and rhinitis as a result of their service. The requirements for this new presumption are that the veteran be deployed to Southwest Asia Theater of Operations on or after August 2, 1990, or on or after September 19, 2001, in Afghanistan, Syria, Djibouti, or Uzbekistan. Also, the condition must manifest within 10 years from separation of service. This policy has the potential to impact approximately 3.5 million veterans. The Southwest Asia Theater of Operations refers to Iraq, Kuwait, Saudi Arabia, the neutral zone between Iraq and Saudi Arabia, Bahrain, Qatar, the United Arab Emirates, Oman, the Gulf of Aden, the Gulf of Oman, the Persian Gulf, the Arabian Sea, the Red Sea, and the airspace above all these locations. VA will assist with verification of qualifying service and help obtain medical evidence as needed. This is just the start. VA is seeking every avenue possible to develop additional processes where a presumptive can be determined in a more expedient and holistic manner for veterans. The good news on these presumptions is that nearly 15,000 claims for one of the new presumptives have already been processed as of early this month. VA is also proactively implementing provisions of the William M. Thornberry National Defense Authorization Act for fiscal year 21, adding 3 conditions to the list for Vietnam-era veterans presumptively associated with exposure to herbicide agents, more commonly known as Agent Orange. Those conditions are bladder cancer, hypothyroidism, and Parkinsonism. Vietnam War-era veterans and their survivors who previously filed and were denied benefits for one of these 3 presumptive conditions will have their cases automatically reviewed. You don't have to refile a claim. Further, VA has sent out letters to impacted veterans and survivors. As I mentioned a moment ago, VA is working on new ways to determine presumptive conditions faster and more holistically. We're working hard on a new model to consider possible relationships of exposure to in-service environmental hazards to medical conditions. The new model will continue to leverage scientific findings from the National Academies of Science, Engineering, and Medicine, relative scientific research data, and surveillance of veterans' health outcomes. The model will also add review of VA claims data and military environmental research for trends. The VA is undergoing a pilot and will use the results of the ongoing pilot to formalize the model after April 1st of 2022. To sum it up, VA is proactively using evidence in our veteran-centric approach to supporting our veterans and their families in attaining their earned benefits. We've already been able to process thousands of claims in a few short months, and we want to make sure every single veteran who is eligible applies as soon as possible. If you feel you have a condition attributed to an event during your military service, we highly, highly encourage you to file a claim. If you want to learn more about the new presumptives, we invite you to visit our website at va.gov or call toll-free at 1-800-827-1000 for more information about VA benefits and eligibility for veterans and survivors, or if you just want to know how to file a claim.
Thanks, Mr. Worley, for that update on presumptive conditions. It looks like we have a few questions coming in, so I want to make sure we can get to some of those before we continue. Just another reminder, if you'd like to ask Mr. Worley a question, you can do so by pressing *3 at any time. Okay, let's take our first question from Brenda in Richmond. Brenda has a question about the best place to go for a surviving spouse to apply for benefits. Brenda, you're live.
Yes,
Good evening,
hello.
Brenda. Thanks for joining the call.
Hello. Like I'm at a total loss. I'm a retired nurse, and my husband passed away about after 50 years of marriage, uh, 2 years ago. So I'm like, okay, dealing with the grief, and then still, dealing with it. I've just left everything veteran, military alone. Now I need to really start
Mm-hmm.
looking into what's available to me. And number
Yes.
one being, what I know. The only thing I do know of is of course, the TRICARE, etc. But like I've got an old ID card. I mean, he kept up with all that stuff, and I took care of home and
Mm-hmm.
children. So
Mm-hmm.
here I am, not knowing anything. So where would the first place be that I would start off doing anything? Because I think he had like 70% disability. He died of prostate cancer, and
Mm-hmm.
I'm hearing about the bladder cancer. So is that associated? Their proximity. In fact, one of his oncologists said that she's been after the VA to consider prostate cancer as a disability. But
Mm-hmm.
to narrow the question down, what would be the first thing I should do?
Well, Brenda, first of all, I'm sorry for the loss of your husband a couple of years ago, and I certainly understand that you've been focused on other things than pursuing what benefits there may be. But I can tell you that there are definitely survivor benefits and things that you can check into, and we're here to do that. And that's part of the reason why we're having this call tonight. We've got experts on the line, and when I get done talking, we'll have someone get with you that can better articulate to you the potential survivor benefits that you're entitled to, and we can get you started toward on the path to receiving those benefits. So you did a great thing calling in tonight, and we'll get you with an expert tonight. But if you have any questions at any time, then please use our 1-800 number, 827-1000, or if you are more comfortable going online, va.gov, and there's a wealth of information at both those places to help you.
Okay, next up we have Joe from Louisville, and Joe has a question relating to the burn pits. Joe, you're live with Mr. Worley.
Yes, hello.
Hi, Joe.
Yes, hi.
Thanks for calling in tonight.
Yeah, no problem. I was in Iraq from 2004 to 2005, and I've been struggling with this cough that I've had throughout the years, and the VA has actually done a lot of tests, but nothing came through with what they're finding. They've diagnosed me with like various things, and I'm taking different, medications for it, and nothing, excuse me, nothing ever helped. But I know when I was going, they told me about, I had mentioned about it maybe being like the stuff that was exposed even before I left when I was getting debriefed. I told them about that, put on my records, because it was really, like, the cough was really bad to a point, when I got out, I was coughing up blood a lot. And they just kept on doing this, but they told me there was a burn pit registration years ago, which I did put my name on it, and then we fast forwarded all those years to now, and I'm still struggling with it. It actually caused me to go into culinary school. I went to culinary school, but my job, a lot of people didn't want to hire me because I was coughing a lot. So pretty much I didn't pursue that, and now I heard that they're really opening it up about the burn pits. I was actually trying to figure out, do I need to call them, or were they supposed to call me? And that's what I just need more information about.
Okay. Thanks, Joe, and I'm sorry for the medical issues related to all of that. and the struggles there. But what's happening in the VA with respect to burn pits is actually quite remarkable. The presumptives I just mentioned with respect to sinusitis, rhinitis, and asthma are considered presumptive conditions as a result of being exposed to burn pits or particulate matter, that kind of thing. And the reason it's fairly remarkable is there hasn't been any legislation on that specifically. The VA is leaning forward, has reviewed the science, and made a determination that we can grant presumptive conditions for those three. Now, I can tell you that the VA is also looking at other respiratory conditions, rare forms of respiratory cancer, for example, bronchitis, and other things now, but those are not approved, if you will, as presumptive conditions related to burn pits yet, but there's ongoing work. So I guess my recommendation to you would be if that you file a claim. I mean, if you haven't engaged in terms of filing a claim recently, that would get an official answer with respect to your current medical condition as it relates to potential burn pit presumptive or other disability ratings. So that's what I would recommend, and we can provide more information for you on that with our experts that are available tonight.
Okay, next we have Jessica from Fort Worth, and she's got a question about transference of her GI Bill benefits. Jessica, you're live with Mr. Worley.
Thank you, sir.
Hi,
as you said, hi, sir. My name is Jessica. I live there in Fort Worth, Texas. I really appreciate getting the chance to talk today. I have a daughter who's just about to graduate high school, so I'm super excited about that. She is going to be going to college soon, and I have GI Bill benefits left over. So I'm trying to figure out if there's any way for me to transfer those benefits to her, only because it would make a huge difference in, my family's ability to support her. And since I don't really need them anymore, I was hoping there was a way I can make that happen.
That's great, Jessica. Well, congratulations on getting your child to high school, through high school. That's an accomplishment as a parent myself. I know that. So are you still on active duty? I'm sorry, well, let me just put it this way. If you're still on active, you have to be on active duty to transfer your benefits, except in certain situations where the transferee may have passed away, and then you could transfer to another dependent. But so that's kind of point one. And I would just urge you to call the Education Call Center, 888 GI Bill 1, if you want to get more details on transferring your benefits, or go to the va.gov website.
Okay, thanks for those questions, and we're going to take more questions in a few moments. Remember to press *3 at any time if you'd like to ask a question. I believe Mr. Worley has another update for us.
Yes, I do, Emil. Thank you very much. The next topic I'd like to highlight is VBA's increased demand to process disability claims. The implementation of the new Persian Gulf and Agent Orange presumptives that I mentioned earlier, along with the Blue Water Navy claims, have led to an increase in the current disability claims backlog, which we expect to continue to grow. Fortunately, we're ready for these increases. We're proactively addressing them in several ways. First, we're hiring and training 2,000 additional claims processors. As a matter of fact, we're really in the final phases of getting those processors on board and into training. We're using the American Rescue Plan funding to pay overtime for our processors. So our rating processors are actually on mandatory overtime, in order to continue to address the increase in inventory. We're also deploying FY22 budget resources to expedite toxic exposure claims processing. And additionally, in FY22, the FY22 budget includes resources to support compensation and pension claims processing, which includes the Agent Orange related claims. I want to add that VA is committed to resolving pandemic-related increases in the disability claims backlog to include ensuring that the workforce essential to processing personnel records are vaccinated and cleared to resume operations. As of November 30th, there were over 250,000 backlog rating claims, which is an increase from January of 2021. And this is due to claims established pursuant to the NEMR court order. The NEMR order allows us to potentially pay benefits retroactively. VA established more than 70,000 claims to review for additional entitlements stemming from the presumptive relationship between Agent Orange and Parkinsonism, bladder cancer, and hypothyroidism. Many of these entered the inventory in October. By working to increase compensation and pension examination capacity and improving access to federal records, VBA plans to reduce the current claims backlog to 100,000 claims by mid-FY 2024. VBA is working with its vendors to increase examination capacity and completions over the next several months, with the goal being to decrease the examination inventory to normal pre-pandemic levels. VA is not making decisions on claims that require an examination if the veteran continues to have concerns about COVID-19 exposure. VA will do all we can to ensure veterans feel safe attending examinations, and will work with veterans to ensure claims are complete prior to completing a rating decision.
Thanks, Mr. Worley, for that update on claims processing time. We're going to take a few more questions in just a couple of moments. Remember to press *3 at any time if you'd like to ask a question. I believe Mr. Worley has another benefit update to share with us.
I sure do, Emil. Thanks. I wanted to provide more on the topic of compensation and pension exams. We're keeping the safety of veterans and examination providers as a high priority and have put robust measures in place to ensure providers can safely conduct these examinations. As we contend with the pandemic, the focus of VHA doctors, the Veterans Health Administration, is patient care. But VHA continues to support VA's compensation and pension benefit programs by completing virtual and in-person C&P exams. Back on May 28th of 2020, VBA's contract examination vendors resumed in-person examinations in limited locations based upon local safety assessments. As of today, I'm happy to report VBA has authorized its vendors to schedule in-person exams in all 50 states and 36 locations outside of the continental United States. The excess pandemic-related exam inventory has been reduced by 35% from its high point in March of 2021. For Texas specifically, it's even better. The reduction has been 36% for the same period and continues to reduce each month. To ensure continuity of examination quality, all contract examiners undergo the same specific training and certification program as VHA providers and use the same disability benefits questionnaires when conducting an examination. VBA requires all contract examiners to receive additional training on things like information security, military culture, and a variety of other topics to further enable their success in serving you. To learn more about compensation and pension exams, I invite you to visit the website, va.gov, and type in the word exam into the search bar. It will direct you to the VA exam page. You can also call toll-free at 1-800-827-1000 to find out more about VA benefits for veterans and survivors.
Thanks, Mr. Worley, for that disability examination update. And again, if you'd like to ask a question live on this call, press *3 at any time. And now we're ready to take some more questions. So let's go to Victor from El Paso. And Victor has a question regarding the VA math. Victor, you're live with Mr. Worley.
Hi, Victor.
Hello?
Victor, are you there?
Yes, I'm here.
Go ahead, ask
Please
your
go
question,
ahead.
Victor.
What's your question?
My question was a while ago. I probably recorded it. Now I will repeat it again. Recently, I received a decision from the VA Board of Appeals, which I waited since 2015, and finally it arrived. And at that moment, since the information had been submitted, and also it appears to me like they originally in 2015 forwarded me an exam, but the individual doctor who probably was not trained and certified, if I'm just listening, just stood at the lobby and said, turn this way, and that's about it. So actually, maybe it's in the benefit of doubts, not only for me as a patient or the veteran, but for them, they send me another exam. But prior to the actual exam, I had already received a settlement plus the monthly rate. Well, the individual doctor at this time, and that was on the 28th of this month, actually the 24th of this month, he went ahead and took care of the actual exam. It was about my C-spine, which affected my right extremity and my left extremity. So it ended up that they decided after that exam here recently, about a week ago, that they were going to give me a 40% disability increase from 10% on my right hand, and the left hand or arm, I should say the whole arm, is 10%. So eventually they gave me a 10 on my C-spine, 10 on my left arm, and from a 10 on my right arm that it was established, it went up to 20, and then they decided to raise it up to 40. But then again, the question is specifically, if those amounts are of percentages as far as disability goes, how do they translate over to the actual rating for the pay purposes? That's the first question, and of what I'd like to ask.
Thank you, Victor. What I'd like to do is let me give you a kind of a high-level answer, and then I'd like to ask one of my panel members to, because I want to make sure we give you the accurate information on how each percentage works as they add to multiple conditions. But what you're talking about is the rating disability criteria overall, and that's contained in a comprehensive document called the VASR-D, the VA Schedule of Disability Ratings. So there are 14 different body systems, and all of those systems are contained, and how the percentages, what criteria have to be met to grant, is contained in this guidance. And we're undergoing a revision of the VASR-D right now, have been for a couple of years, and have modified and updated about 10 of the 14 body systems. So that's more than you wanted to know on the big level, probably, but I just wanted the listeners to know that there's a complete review of all those criteria going on that has been going on for a few years and will continue for the next probably 2 or 3 years to complete it. And that's the first comprehensive review of the VASR-D since 1945. And it's important to do that because medicine changes, conditions change, medical technology changes. But it's also important to know that if you currently have a rating, any change to those criteria in the future won't impact your current rating. But specifically to your question about how the percentages are calculated, I'd like to ask Ed, can you, on my panel, I've got a panel of experts to help me. Ed, could you take that question?
Good evening. Yes, sir.
Good evening.
I can give a very overall explanation, but I think it would be best if we could have him speak directly with one of our individuals so that they can literally go through his rating and show him how the rating scale comes to the combined overall rating that we utilize from the medical evidence as well as the medical opinion that's received during the CMP exam and match it up to the schedule of rating that allows us first to arrive at our percentages, and then we use that information in order to break it down to the overall combined rating. But it may be a little more than we can go over here live on the line.
Right. Basically, as
Can you,
disabilities are found, it gets deducted from your overall 100% ability, which everyone starts with. And you start getting into bilateral factors and things like that. So as Ed mentioned, it's best to take the situation offline right now, and that way we can ensure we handle the claim properly. And next up, we have Jody from Waco. And Jody has a question about managing your expectations for timelines. Jody, you're on with Mr. Worley.
Mr. Worley, I've changed my mind. I've got something that's more pressing. First of all, thank you for having this get together. There was a mission in Vietnam called Operation Tropical Moon, based out of Udorn, and they had a squadron of 10 Air Force pilots. And during the course of this, they were tasked for 6 months TDY in Vietnam in the I Corps area, and I represent the commander was able to receive benefits because he produced some records which were formerly classified. And the VA doesn't have these records, nor does NPRC. And I've contacted the VA on 3 occasions because there are 10 other officers on these orders who are eligible for NEMR benefits. And I want the VA to find these people. And I've been frustrated and having success with it so far. I've got copies of the orders. They got their names. They got their service numbers.
And you're aware that they haven't been able to be contacted by the VA?
Yes, sir. I represented the unit commander, and he's deceased now. I promised him I was going to, get with the VA. We were going to find these people, but he was able to produce the orders, and he received his NEMR benefits. But attached to the orders were 10 other officers that were pilots in this mission, and they're eligible for NEMR benefits. And it's stamped secret. Of course, it's declassified now, but NPRC and the VA doesn't have these records. And I've tried on 3 occasions to get the VA to help with this, and I come back with nothing. I'm sorry about throwing you a question like this, but
No,
I know
that's okay.
I know y'all want to help these guys, So
of course, and as far as reaching out to veterans, we can reach out with whatever information we have for them, whether it be address or whatever. Let me ask Ed, do you have any thoughts on how we could help in this situation?
Yes, sir. Good evening again. Yes, sir. Just so that I make sure that I'm understanding your question correctly, could you just repeat it once more, and I'll try to break it down to the best of my ability. Hello, sir.
Yeah, hi. We'll have to take that one off the air. He's no longer live on the call. So
okay.
Let's go to.
I think it had to do with. Yeah. Go ahead.
Okay, let's go with William from Houston. He has a question regarding how long claims should take in the decision phase. William, you're live with Mr. Worley.
Yes, thank you for taking my question. You've kind of answered when you talked about how people you're bringing back in to train to take care of caseloads and everything. And I guess I was a little anxious because I have a claim in since June for bladder cancer, which MD Anderson Cancer Center here in Houston took my bladder out several years ago because of the cancer. and so I thought it'd be like a open and shut case. But every month since June of 21, I call and I get told that my claim, and I just found out that I didn't have to start a claim because I already had a claim for bladder cancer from the VA looking at me. But I was just asking, where does it stand, the claim? And I always get the answer that's in the decision phase. So I guess I just have to wait and be patient until they come up and make a decision on bladder cancer. And I'm so glad that you did finally decide to honor that type of diagnosis, because nobody really knows how our doctors tell us that it's a kind of an unusual cancer, and they're not really sure how a person gets it. And then you go to the Agent Orange circumstance, and people are still finding out what Agent Orange causes. So I'll just keep waiting until it comes to a decision.
Hey, William.
I was kind of wondering, should it take several years before there is a decision?
No, William. Thanks for coming on and asking that question. And you're a Vietnam veteran, I take it?
Yes, sir. Yes, we flew.
And thank you for your
helicopters, and we were all over Vietnam and Cambodia, and so the results of Agent Orange and everything. And then, of course, there's a lot of, I've heard too, additives that they had in the fuel to keep it fresh and everything that caused a lot of problems with veterans.
Mm-hmm. Yeah. Well, just to give you an idea, because of over the past really 5 to 10 years, the VA has done a tremendous amount of modernization, trying to streamline processes. We're not in paper anymore. And I can tell you from personal experience in the VA that there is a continuous effort to improve our technology, improve so that we can serve you better and do things faster for the veterans that we serve. It's on average, when a disability claim comes in, we're processing them in around 120 to 130 days. But that's the average. So some take longer, some take not as long, and it all depends on, if exams are needed and, more medical evidence and all those kinds of things. But it seems like we should have had an answer to you just on first look here if you filed in June. So let us have one of our folks discuss specifically where your claim is and see if there's some reason why it's held up, and we can hopefully get this thing straightened out.
Okay, once again, folks, press *3 if you have any questions for Mr. Worley. Next up, we have Jose from Houston, and he has a question with regards to presumptives within a year coming back from service. Jose, you're live with Mr. Worley.
Yes, sir, Mr. Worley. Hello. Can you hear me?
Hi. Yes, I can, Jose. Good to have you.
So I have a question. Good to be speaking with you, too, and get some clarification on this. About those new 6 presumptives you talked about earlier on the toxic exposure, which included asthma, sinusitis, and rhinitis. In order to be considered presumptive, it usually is within 10 years. What if the situation is that as soon as we came back from Iraq within a month, and the other one within still the same year was diagnosed with both sinusitis and rhinitis? Have those documented on military hospital records. But then the VA requested you show them continuity of diagnosis or symptoms, and you get out with it after that year. And the way the medical system works now is like civilian medical system. After 7 to 10 years, they purge their records. So there's no way you can get records filling that gap anymore. How does the VA handle that? Especially if this was back in 2005. Is that original diagnosis while still in service, immediately coming back from deployment within a few weeks, good enough, or are they going to expect to show the continuity of symptoms throughout, even though those records are no longer available because of purging, how they purge the system every 7 to 10 years now?
Thanks, Jose, for that question. I don't know that the continuity issue is an issue. I would say if you file a claim, file with us, because it sounds like to me you're definitely in the ballpark of this presumptive, these new toxic exposure presumptives.
Yes, sir.
So the best.
When I have it diagnosed within, like I said, within the first year. So.
Yeah, absolutely. So press on, file a claim. If you need more information about how to do that, we can talk further with you offline. But
Sure.
But you should definitely submit, because that's what a presumptive is. By virtue of the fact that you were in those locations during a particular period of time, we presume that that toxic exposure resulted in your sinusitis, rhinitis, or asthma, and so if you have that condition diagnosed, it sounds likely that you would be deserving those benefits. So just file a claim with us, okay?
Okay, once again, folks,
Thank you.
star 3 if you have any questions. Next up, we have from San Antonio a very timely question regarding our new clinic opening in San Antonio. I believe it's Mikhail or maybe Michael from San Antonio. You're live with me.
Yeah, can you hear me?
Loud and clear.
Yes, we got you, Michael.
Yes, sir. Hey, thanks for taking this time, sir, and I appreciate this. I just had a quick question. I know there's a new clinic opening up in San Antonio, or maybe opened over in the SeaWorld area. Are there going to be benefit counselors in that facility? And if so, do I need to make an appointment, or can I just stop by?
Thanks, Michael. Yes, there is a new clinic opening. VHA has completed construction there, and they've been gracious enough to offer us office space over there. So this is your Veterans Benefits Administration and Veterans Health Administration partnership. Excuse me. And it's a beautiful new clinic. And yes, there will be claims processors there that belong to the Houston Regional Office, but we have employees over there in San Antonio to take care of the veterans there. We also have Veteran Readiness and Employment employees over there to take care of our Chapter 31 veterans. And we have a public contact function that is open now. Well, I should say will open in that clinic on February 14th to serve veterans face-to-face. So that's a great opportunity to let people know that our public contact over in San Antonio is moving from the Frank Tejeda outpatient clinic to the Northwest Healthcare Clinic, the brand new one with VHA over there. And it also gives me the opportunity to just highlight that you might have heard information about from the Secretary about the AIR report. The Secretary is looking hard at the healthcare infrastructure across all of VA, and is looking to the future. Our infrastructure is fairly aged, and this is a comprehensive study and reporting to Congress that will set the course for the future for the infrastructure we need to take care of our veterans. But thanks for that question, Michael.
Okay, next up we have Andres from San Antonio. He has a question about how to apply for a position to process claims. You're on, Andres.
Good evening, sir. Thank you for taking my call. And yeah, that's basically my question is, like, I know you were talking about you guys are hiring processors and stuff like that, and I wanted to know, how does one apply for that position and what are the qualifications?
That's right. Thanks for the opportunity to respond to that. Across the nation, we're hiring about 2,000 new claims processors, and our particular at the Houston Regional Office, we're hiring about 80 or so, and I think Waco is hiring probably even more than that, so that we can quickly get these claims processed and get the backlog down. The best way to find out about these positions always is to go on USA Jobs That's where the position descriptions and the opportunity to apply comes. So you can read. I can't give you the qualifications of all the different positions, but you can get what those qualifications are by looking at USA Jobs. Now, most of those we're kind of late in the process, so most of those that are associated with the presumptives, we've already filled. But that doesn't mean, some of it is internal churn, so some internal people are getting promoted. That opens up other opportunities. So I encourage you to use USA Jobs and apply.
Okay, thank you. So next up we have Oscar, who's asking if the new presumptives may affect him. Oscar, you're live with Mr. Worley.
Hi, Oscar.
Good evening, sir. My question is pretty specific. I'm 100% disabled or unemployable. These new presumptives don't affect me at all, do they?
It doesn't sound like it, but again, the presumptives are related to. Are you Gulf War or
Agent Orange,
Vietnam for Vietnam era and 3? Okay. If you're already 100% and you've got all the benefits, then they may not help you. But we always encourage people to file a claim to get a firm answer and get the system to address the question. So that's up to you, but I'd encourage you to file.
Okay, next up we have, I believe it's Please, and I'm sorry if I mispronounce your name, from Sandia. She's got a question from one retiree to another about medications on the base. Please, you're on.
Yes, sir. My question is, can you get your medications from an active duty base instead of having to go through TRICARE?
Okay, I'm not sure about that. If I heard your question right, you want to get your medications from what base are you near?
Close to NAF Corpus.
Corpus, okay. Okay, I'm not sure I know the answer to that. Is anybody on the panel aware if it's possible to get medications on the base as opposed to?
Sir, yes, sir. I would advise them contact TRICARE directly so that they can determine if within their area the medications can be authorized. I can provide the direct contact for TRICARE if that would be helpful. And so for TRICARE, they would call. Oh, yes, sir. So for TRICARE, they would call 800-444-5445, and in that instance, you can have them put you in contact with your provider for TRICARE, and they can make the determination if you can get those medications actually on base or if there's another location that is more preferable.
Okay, thank you, Ed. And for time purposes, it looks like we'll have our last caller of the evening tonight from Tiffany in Houston regarding timelines for processing claims. Tiffany, you're live with Mr. Worley.
Yay, I made it. Hello,
Hi,
Mr.
Tiffany.
Worley, for taking my call. Yes. I
Absolutely.
have also had a claim since June. I don't fall under that presumptive, what you were talking about. I heard that my claim has been looked at. Well, my claim has been in the decision-making phase since November, and it was last looked at in January 16th. So I'm not sure am I in that backlog or where do I fall in that?
Okay. Well, if your claim is over 125 days old, that's what's considered in backlog. So it sounds like it is, but as I mentioned to the other gentleman, if let us have someone talk with you offline here. We have folks available to speak with you and can give you perhaps a better status and see, just where it stands. Hopefully we can get that moving.
Okay, thank you. Do I stay on the line or?
Thank you.
Yes.
Yeah.
Okay.
We'll get you in touch with someone.
Once again, folks, all of you who called in tonight, we will have someone handle your calls offline. That's all the time we have permitting this evening. Aaron, I will answer yours real quickly for everybody's edification. There is no time limit to file a claim. So if you serve for our country, you have every right to file a claim at any time. So, again, folks, that's our last caller live for this evening, and we certainly appreciate those thoughtful questions. Mr. Worley, do you have anything to add in parting?
I do, Emil. Thank you. Just want everybody to know the bottom line is that we're here for you, and we work every day to serve you just as you served your country. If you have further questions or need assistance learning about your benefits or filing a claim, please call our toll-free number, 800-827-1000. You can also set up either a virtual or in-person appointment at the Waco Regional Office, the Houston Regional Office, or at our other locations, our San Antonio location. And you can do that by going to benefits.va.gov/Houston or /Waco and use our new appointment system called VERA, Visitor Engagement Reporting Application. You'll see VAVERA when you go to that website. Again, that's benefits.va.gov/Houston or /Waco. And that'll take you to the website. You can go through, it's a very easy process. Put in your zip code and where you want the appointment. And again, you can request virtual or in person. Finally, if you or someone you know is a veteran in crisis, we want to talk with you right away. We have a live crisis line. It's operated 24/7 with caring, knowledgeable representatives who want to help. You can reach us at that crisis line anytime, day or night, by calling 800-273-8255, 800-273-8255, or you can text 838-255. That's texting 838-255. Well, it's been a real pleasure being with you tonight. Thank you for your questions. We had a great Texas Town Hall tonight, and again, thank you all for your service. And just know that your VA is here for you. Back to you, Emil.
Thanks so much, Mr. Worley. And just because it's so important to us, I'm going to repeat those numbers again for anyone who might be in crisis, or if you know someone who is. Please call 1-800-273-8255 or text 838-255. Mr. Worley, we certainly appreciate your time and the valuable information you provided for our veterans. I want to remind everyone how you can get more information on the topics Mr. Worley highlighted. For more information on the new presumptives, the disability claims process, or compensation and pension exams, you can visit va.gov or call 1-800-827-1000. As a final reminder, you can schedule a virtual or in-person appointment with Waco or Houston employees through our VERA system, which can be found at benefits.va.gov/Waco or /. To follow us on Facebook, search Veterans Benefits Administration, Twitter @VA Vet Benefits, and Instagram VA Benefits. Well, this concludes our Teletown Hall for Texas. A big thank you to all the veterans and family members who called in. Good night, and thanks for your service.